An upsurge in violence in northeastern parts of the Democratic Republic of Congo has left thousands of civilians in urgent need of humanitarian aid. The violence is affecting staff attached to Doctors Without Borders, struggling to contain an Ebola outbreak that has killed more than 1,500 people. Here's the MSF South Africa spokesperson, Borrie La Grange, who joins us now on via Skype. Good evening, Borrie, and welcome to The Full View. Let's just first start off by giving an understanding of what's currently happening in the DRC and how this has affected your operations as well.
Okay, so what we know so far is that the Ebola outbreak has been raging for 16 months or more. And as you've mentioned, like quite a large number of people have died because of this and because of difficulties to try and bring the spread of the epidemic under control, because of level of insecurity and a lack of distrust among the local population in the Ebola response at large, being run by the Ministry of Health of the DRC and also the World Health Organization. And this should also be seen in connection with the level of dissatisfaction and distrust for UN peacekeepers in that particular area. So we're talking about the Ituri province and also North Kivu. And both of these locations are places where we've seen protracted conflict over a number of years, in particular where the civilian population has borne the brunt of the violence. So it's trying to do a response to curb the Ebola outbreak, but in a very hostile and quite a difficult environment in which to operate. Now, the upshot of this has been that we took a really difficult decision just 2 days ago in which we had decided to halt our activities in an area called Biakato, which is where the epidemic is still active. The reason for our decision to halt our activities and pull out our team is because the security forces have been deployed into medical facilities. And this follows an incident on the 28th of November where 3 people involved in the Ebola response were in fact killed in an armed attack. So you can see that the situation has escalated quite rapidly, and it's for us cause for great concern, because as an independent and impartial provider of medical care in crisis situations, we want to avoid absolutely that we're being seen as being part of one side of a conflict or another. And so based on that is that's what informed our decision to halt our activities. As difficult as that is for us, it is, we believe, a necessary step.
Who's claiming responsibility, Borrie, for these attacks?
Well, Aljan, I think that's something that can be discussed with a greater level of accuracy with security analysts. We're a medical humanitarian organization. Our primary concern is to deliver medical aid to people in need, but in as much as we can in a safe environment where we have a sense of how to manage our security properly to ensure that our patients remain safe and our staff also remain safe.
Has there been any assistance that's coming from the government?
So when we look at this response to the epidemic over several months, it's been a large effort coming from the World Health Organization, from ourselves, some other organizations also involved, but also the Ministry of Health in the DRC. We need to remember that this is the 10th outbreak of Ebola in the DRC over a 30-year period. So there is quite a lot of knowledge and experience in dealing with Ebola outbreaks in the DRC within the Ministry of Health. But what we need to understand is that the dynamics of the conflict is such as that there's potentially questions that can be asked in terms of like how the response is viewed by members of the community. To give an example, just a couple of months ago, one of our DRC colleagues who lives in the area said that, well, it's as if the world has forgotten about this particular area, the civilians in that area, and that now that Ebola has caught the international community's attention, now it's as if all the help is rushing in. But prior to that, when her children were sick with malaria, when the community was being attacked by armed groups, it's as if the world just turned a blind eye. So you can understand that there's a level of distrust within the community, and that for us as a medical humanitarian organization hampers our work. So we've put in a lot of effort in terms of trying to rebuild that trust so that we're in an area and we're working and we say we're impartial. We can demonstrate it by saying we're not attached to any side of the conflict. And those are important components of how we do the work, aside from the medical activities that we're responsible for.
Quite a lot of work that you guys are doing, not only in the DRC, but around the globe as well. We're actually showing visuals and pictures that you have released, telling 1,000 stories in 50 pictures. Tell us about that.
Yes, so photography and visual, like video material, is incredibly important for our ability to bring to light the experiences and often the suffering that goes unnoticed at large in the world. And so what we've done is every year we compile a selection of photographs. In this instance, we selected 50 photographs that demonstrate the variety of situations that vulnerable people find themselves in around the world. So we've selected images from Italy, where migrants and refugees are struggling to find a safe refuge, from Gaza, from Lebanon, Malaysia, more particularly, where we've seen, I think everybody's pretty well aware of the Rohingya Muslim refugees currently in Bangladesh, but not many people know about the high number of Rohingya Muslim refugees who are seeking refuge and trying to survive in Malaysia, for instance. And in that country, they also find it incredibly difficult to access proper medical care. One of the images on screen at the moment is that of a young woman who has found it really difficult to access the care that she requires. She suffered a broken leg. She's also divorced, so within that society, she's incredibly stigmatized. Some of the other images we can see now are men peering through a hole in a door at a detention center in Libya, where several thousand refugees and migrants are being detained with no certain outcome in terms of when they would be released or if they would be subjected to any due process as such. And people find themselves in this exploited environment where they're being made to work without pay. We know that this is also the conditions that they're living under is incredibly difficult, so in cramped spaces. It's easy for infectious disease to spread in these places. But then when people do manage to leave those places, they take incredible risks. We've seen the visuals, we know the stories of people trying to cross the Mediterranean to reach Europe, to find safe passage is impossible for them in any other way. So it's important that we document these stories, that we show the people who experience these things, who have legitimate medical needs that are often forgotten or ignored. And that is our mandate as a humanitarian organization, a medical humanitarian organization, is to provide the care, but also to bear witness and to share these stories with the world.
Well, thank you so much for your time, Borrie. Really appreciate your time. And to people who want to go and see those images, they can just go on Google and try and find some of those images. It's quite incredible. There's one in particular that really struck me. This was what looked like a teenage boy sitting next to diffused rockets. And it was quite powerful. Thank you so much for your time, Borrie La Grange, who is the spokesperson for MSF South Africa.
Now back here at home.